So when we're assessing a patient's elimination functions, it's really important to ascertain whether they're continent or not, so urinary continence or fecal continence as well. So if we have a patient that is urinary incontinent, if we have a baby who is urinary incontinent, we would have had a nappy on. Yep, and we'll demonstrate that in a little while. There's certain devices that we can have to manage adult urinary incontinence, and one of those devices is called a urodome. So the urodome is like a condom device with an opening at the end, which is attached to a drainage bag. And the whole idea is that the condom stays quite fitted on the penis, and then it drains the urine away without leaking. In my experience, they haven't been terribly effective. I think they leak quite a lot and they fall off quite a lot, and they can be quite uncomfortable. So it's really important that when we try and apply the urodome, we do it once and we do it well. I think that's it. Do you have anything other?
I guess my suggestion would be to make sure you're putting it on the right patient. So if the person's confused and likely to
be pulling
try and take it off, or just may not have good anatomy to be able to wear it properly, that an incontinence pad might be a more appropriate solution. But if a person isn't confused but does have incontinence issues, I find the patients I've applied it to have been more longer term users of that product. They tend to use it themselves and know how to use it properly. So I've not used them very much at all, but when I've used them, it's usually in a longer term situation. Yeah.
So outside of a hospital environment, probably in an aged care facility, is probably where I've experienced applying urodomes most frequently. So let's have a look at it. We have the drainage bag, which attaches to the urodome and collects the urine. And we have the actual urodome. They come in different sizes, but not as varied as other things. So we've got small, medium and large, pretty much. So you need to actually have a look at your patient first and to ascertain what size before you select your product. Inside the pack, we literally have some double-sided tape and the urodome. And as you can see, the urodome does look like a condom with a tube out the top, and this is where the tube gets attached to the drainage bag. So before applying the urodome, it's really important that the surface area is clean and dry. So if you've had a patient who has been incontinent, it may be worth the while giving a nice warm soapy water wash and then drying the penis quite well and making sure that we can get a good attachment. So the tape's actually quite challenging. If we don't get the tape in the right position, the whole thing's going to fall over in my experience. And the tape is quite challenging to place because we have pubic hair and skin folds, so it can be quite difficult to actually apply. So that's where this little device is fantastic, and you'll see them in any of the urodome kits on any of the facilities, and the wards should have them. And these is literally placed over the penis and it pushes back skin and pubic hair, so it keeps it away from when you're applying the double-sided tape. There's perforation here, so you can just rip that off once you've actually got it in situ. So I'm going to demonstrate the application of a urodome now. Manny, we're going to apply a urodome just to help you with your incontinence for the moment. Is that okay?
Yeah, okay.
Do you know what a urodome is?
No, I'm not really sure.
Okay, urodome is like a condom that will go over your penis and will collect your urine. So it will keep you nice and dry, and it will stop you having to be wet and being changed all the time.
Okay.
Is that okay?
Yep.
Do you have any further questions about that?
Do I empty that into the toilet or?
You can empty that, or I can empty that for you. It's completely up to you. I can show you how that's actually done. The things that you need to remember is that you need to take it with you when you go for a walk. That's one of the most important things. It's a little bit uncomfortable. It is literally sticky tape that's holding down the condom-like device, and so it can be a little bit uncomfortable. When I apply it, you just let me know if we've got a hair catched or it is uncomfortable, and I'll see if I can fix it for you.
Okay.
Okay. So what I'm going to do is lie you down a little bit, if that's okay to start with.
All right.
I'm going to start just by having a look at Manny's anatomy. So as I previously mentioned, it's really important to have a look at the anatomy before you get started. So Manny, I'm just going to have a look down here if that's okay. Okay, so I've got some good accessibility here, and I also can see that Manny is not circumcised. When you have a circumcised penis, it makes it a little bit more challenging because you need to actually make sure that skin is in a really comfortable position for the patient underneath that urodome. Hand hygiene. Okay, I'm going to use my guide. And as you can see, that pushes everything back and beyond that point, so I'm not going to get any skin stuck or hair stuck around the shaft of the penis. And it literally is double-sided tape. So as far down as you can possibly manage. And then remove the outer wrapping. Just make sure you start the rolling down of the urodome to start with, just to make sure that it's not stuck, because it is quite sticky. And make sure you get the base of the urodome and it connects with the double-sided tape. Once that's in place, you attach your drainage bag. As with a catheter, it's really quite important to attach it also to the patient's leg, and make sure you don't attach it too tight because you don't want to be pulling it off when the patient stands up. Then we remove our guide just by ripping the perforation. How's that, Manny?
That's good, thank you.